Thank you so much, Dr. Lakshmi, for those kind words. I know we're running out of time, so I would like to be very precise, just like how the robotic surgery is going to be precise, and quickly take you through the journey of the fusion of AI and robotics, and how today we are looking at the smart scalpel. As you all know, scalpel is a symbol for surgery from decades. So now the regular scalpel, the knife and the surgeon's hand, now from that we have moved to something called a smart scalpel. So from a traditional surgery, we moved to something called as a smart surgery. So what does it mean? Basically, smart scalpel talks about the integration of technology, tissue recognition, robotic articulation, AI feedback. So basically, it's a next version, an advanced version of the regular scalpel that we have today. So today we are shifting towards data, automation, and intelligence. So the surgery is moving, in a much, much faster pace towards minimally invasive nature. So, what used to be a big surgeon, big incision era has moved towards a small incision and still a big surgery. So why does this matter now? Why should we look at smart scalpel and how does robotics solve the problem? So we have rising surgical demands, as many of the previous speakers mentioned. The work for surgical errors in the theater can be definitely addressed with smart scalpel. And of course, we need more precise and minimally invasive surgery. So you might be asking, why do we really need a smart scalpel or robotics, even if we have laparoscopy and open surgery? From a patient point of view, how do you define a surgery? Surgery is nothing but it's a controlled injury that we cause. So the value or the outcomes of a surgery is measured by the amount of bleeding, by the infection rates, by the amount of scarring that somebody has, bowel dysfunction, wound complications, and also the postoperative pain that one endures. Based on this, a surgery is gauged or measured. So if this has to be less, from the patient's point of view, the value of a surgery is directly proportional to efficacy. Whichever modality somebody may take, whether open or laparoscopy or robotics, it should not compromise with the efficacy or the outcomes, especially in oncology. But what is more important is, the patient's value is inversely proportional to invasiveness square. Thereby, less the invasiveness, more the precision, more the patient value. So this is where I think my whole talk will be revolving around surgery as a controlled injury and also the patient value, how minimally invasive surgery can give better outcomes to our patients. If you look at the journey from open surgery, manual surgery to initial laparoscopy was a lot of skepticism was there for laparoscopy. People didn't even adopt or accept laparoscopy, but then we moved on towards advanced laparoscopy, and robotics came into work. Way back in 2000, the first FDA-approved Da Vinci robot came into presence. So today, the next big innovation in surgical space is AI-assisted surgery. That's what is the most interesting thing that I am looking at. So the next generation surgery will be more intelligent. It will be much more intuitive, and it will be incredibly precise so that the surgery or the patient value is much, much higher and less side effects to the patient. So I will be quickly taking you through what robotic surgery is today and preoperatively or intraoperatively or postoperatively, how does smart scalpel or the integration of AI with robotics can give better outcomes to our patients. So what really is different in robotic surgery compared to laparoscopy? The beauty is 3D image that we have. The ergonomics are much, much better because in robotics, you sit on a surgeon console and operate comfortably without any fatigue or without any filter. The tremors are filtered. Motion scaling is possible. Telesurgery, you must have heard, it's been already practiced in China. And the first transatlantic telesurgery was done 20 years back across the cable. So in that sense, the future is going to be much more exciting. Maybe I could go to the extent telling that you can do surgery from home. So high range of motion of instruments is possible, and the stable operative platform. So look at the laparoscopic surgery there. Most of the surgeons seated here would appreciate with me. You depend a lot on your assistant. You shout on him, show me here, show me there. Don't shake, come closer, stay there. Turn left, right, all this, the assistant will take the brunt of the surgeon operating. Whereas you see in the robotic on the right side, in fact, the assistant doesn't have much role. Probably he may be put into sleep. So what is the real difference during the surgery from laparoscopy to robotic? If you see here, the difference is that, you can see the anatomic structures much, much better from things that has to be removed, from that has to be preserved, especially to give the best outcomes to our patients in terms of the, functional the abilities. So if you see here in this video as well, the dissection is more precise because of the 10 times amplification and a 3D view. Many times I say that, you can literally catch hold of a red blood cells, because a little bit of bleed, actually the whole field will be, spoiled. So that is the beauty of robotic surgery. So if you look at the difference, the assistant, you have 4 arms with robot. So you have a camera on your control, you have 2 arms working, and then you have a 4th arm. So that will be your excellent assistant, helps you in good retraction.